Hey everyone, it's Denise Brown from the Caregiving Years Training Academy. Thanks so much for being with us. This is our Care and Share Big Ideas February event. We've been meeting for 2 days. This is our second day. Each day we gather, we are sharing 2 ideas and then engaging in a conversation about the ideas. And I'm thrilled and excited to have Rebecca start us off today. So Rebecca, tell us about your big idea.
It is a big idea, but it's not novel. In fact, Denise has in the past written about this and advocated for it. Things are changing in the healthcare scene, so let's readdress it. I don't know why that didn't go down. There we go, pardon me. Some CDC stats. The latest we have from them is for 2019. They're still working 2020. But people with Alzheimer's disease and related dementias are usually cared for by members of the family or friends. The majority, 80% of people with Alzheimer's and related dementias are receiving care in their homes. And I thought that was an astounding number. So I had to look further and try to figure out why. And it's because a diagnosis of dementia does not automatically make one eligible for nursing home Medicaid. This is especially true with individuals who were diagnosed in the early stages of the disease. And we'll talk a little bit more about that later. But each year, more than 16 million Americans provide more than 18.5 billion hours of unpaid care for family and friends with dementia. Approximately 2/3 of dementia caregivers are women. About 1 in 3 caregivers is age 65 or older. And approximately 25% of dementia caregivers are the sandwich generation, which means they are not only taking care of an aging parent, but also caring for children under the age of 18. Caregivers of people with Alzheimer's and related dementia provide care for a longer duration than caregivers of people with other type of conditions. And well over half of caregivers of people with dementia provide care for 4 years or more. However, as the condition progresses, these carees will certainly meet Medicaid's nursing home level of care requirements. A place for mom. Many people are bringing their loved ones home right now. The 136,000 residents and staff of nursing homes and long-term care facilities have died from COVID-19. 36%, really edging up more to close to 40% of COVID deaths are attributable to nursing homes and long-term care facilities. Families feel that COVID plus isolation is responsible for deaths, and family members are moving loved ones out of facilities and into their homes. And unless it's coordinated with the facility and the proper agencies upon removal, Medicaid funds paid to facilities do not port with the families. This is from AARP, their 2020 report. Again, the 18.5 billion hours of caregiving, that represents a contribution to the nation valued at $233 billion. That's how much that manpower is worth. To put that in perspective, that's 10 times the total revenue of McDonald's. Consider that 61% of caregivers are also working. And there are pitfalls to being uncompensated in-home caregivers. An increase in living costs, groceries, toiletries, prescriptions. Caregivers often deplete their savings and even take on debt to give care. There's often a loss of hours at work, and most often there's no compensation for that time off. So that means less income is earned. So income security and job security are imperiled. And contributions to Social Security are impacted. It's very important because if you're not working and contributing, you're going to have a smaller check in your retirement years. Let's do a little math. I have a degree in finance. I was a banker, so I'm sorry about all the numbers, but let's kind of stick through this. Let's say the average pay for CNA right now, $13.72 an hour. ARP right now projects that, or says that 24 hours of caregiving are on average given by family member per week. If you move that up to full time because it's compensated in some way, it's 548 hours, $548, and an annual compensation of $28,537. Now look at what Medicaid pays. In North Carolina, again, using my home state, Medicaid pays nursing homes $229 a day per patient. If it paid that to an in-home caregiver, imagine that, $82,440 a year. I don't think it would happen to that degree, so perhaps there could be a compromise in the difference of $53,000 in those two figures. Excuse me. Okay, and this again is North Carolina. How the waivers work right now, there are some sources of income for in-home caregivers, Medicaid waivers for persons with limited financial resources. That means that Medicaid can pay for nursing home care, or for those who wish to live at home or in assisted living. Sometimes Medicaid will pay for those in those locations if it's less than being in a nursing home, a lower cost. And it does this through the Medicaid waivers. And currently states have Medicaid home and community-based care service waivers, which allows people to receive long-term care in their homes instead of an institutional setting. And how that works here is that the caree, the patient, is the employer, and a third-party agency sits between North Carolina Medicaid and the care provider. The care provider submits timesheets, and the third party bills Medicaid, receives payment for Medicaid, withholds, and then pays the provider. Medicaid waivers, however, are limited to who can use them. They're for those with low income and minimal assets who would normally receive Medicaid, not to be confused with Medicare benefits. Veterans are a whole nother area. Just briefly, sometimes caregivers are eligible for assistance through the aid and attendance benefit, cash benefit for veterans and their surviving spouses. Good news that could be better. President Biden has said we're trapped in a caregiving crisis within an economic crisis within a healthcare crisis. His economic plan, part of it, proposes $775 billion to be used over 10 years to expand and improve care for children, elderly, and the disabled. President Biden's proposal shows a growing recognition that looking after these members of our society is a critical part of the U.S. economy. The plan includes scrapping the Medicaid home and community-based service waivers we just spoke about, and implementing a new program with more federal funding. He also wants to hire 150,000 community healthcare workers. Ambitious. Now, the plan includes elements aimed at aiding unpaid caregivers who take care of family members. It proposes a $5,000 tax credit. But if a caregiver is not working, does a tax credit have any value? And the key is whether the tax credit is refundable or non-refundable. If it's non-refundable, it can only be used if you're already paying taxes. If it's refundable, it would work like an earned income tax credit, where you could claim a refund on your tax, even if you had little or no income tax to pay. But right now, the economic plan does not provide enough information to determine whether it's refundable or non-refundable. So is that $5,000 tax credit really going to help? The other thing is Social Security credits. This is significant. I think this is a significant benefit because of what we discussed earlier, paying into your Social Security under these circumstances of caregiving. So who's going to pay for this? Taxpayers. But there's an upside to this. A boost to the economy if caregivers were compensated, because compensated caregivers become taxpayers and they become consumers. They consume more because they have money to spend, and that helps to expand the economy, leading to more manufacturing and more jobs, and ultimately creating a greater overall payroll tax base to help fund this ambitious plan. Bottom line, caregiving can't be considered a volunteer position any longer. The human sacrifice for both caregivers and patients is too great to ignore, and it must become an integral part of established health practices. One last thing, there's a sense of urgency about this as never before, because the nursing home industry faces a financial crisis. About 90% of nursing homes are underfunded, operating at a loss, and more than 65% said they will be forced to close within the year due to overwhelming pandemic-related costs. And there's nothing right now in the plan that addresses that directly, but you and see the sense of urgency. Where are these people going to go? And that's my idea. Thank you.
Okay, thanks, Rebecca. I'm going to share my idea, and then we're going to engage in a conversation about both of the ideas. Okay, so my idea is a community caregiving manager. So let me tell you what I think that means. So we need help during our caregiving experience, obviously, and our local governments need revenue. So I think something like a community caregiving manager can solve that problem. So I've been doing annual surveys of family caregivers for the past 22 years. The last one I did was 2017. I ran out of time, which is why I haven't updated it since 2017. But I asked about backup plans in that survey, and 74% of those who took the survey don't have a backup plan. And then 50%, almost 50%, don't have any help. They're doing it on their own. The reality is we don't have a plan in case of an emergency. If we did not realize that before COVID-19, we realize it now. We do need an organization in our communities that serves all family caregivers, meaning it doesn't matter the age of the caree or the age of the family caregiver. It's a organization that serves anyone in a caregiving experience. In addition, we need local elected officials to understand the experiences of family caregivers in their communities. Local elected officials have an idea of what it's like to be a parent because of the school district, but there is no way to effectively capture the experience of family caregivers. And if they knew it, I think how our communities are run would be different. Okay, so with a community caregiving manager, we have an employee of our local government that connects family caregivers with help and support. The community caregiving manager offers planning sessions with family caregivers in the community. Those planning sessions are actually a revenue generating service for that local government. It could be a sliding scale fee based on income level. In addition, because the community caregiving manager is connecting with family caregivers on a regular basis, they can connect data and experiences of what family caregivers in that particular community are struggling with. In Illinois, we have park districts. So many of you are from Illinois, so you know that where you live, you have a park district. In my suburb, I get a catalog on a regular basis that says, here's the fall programming, here's the spring programming. And a lot of the programming is for kids. There are some for adults, but we know that for the kids, it's programs in the summer, it's after school programs, but there are no programs really other than for seniors that are for family caregivers. And what if, as part of the programming for something for park districts in Illinois, because that's something that's specific to Illinois, you could book a family emergency planning session with your community caregiving manager. So the planning session is something that our certified caregiving consultants offer to clients. And it's a family emergency planning tool. These kinds of planning sessions could happen annually. If after the community caregiving manager meets with a family caregiver, if you guys don't mind muting, that would be great. If, for instance, at the end of the planning session, it seems like the family caregiver needs more help and more support, there could be other planning sessions that happen. There could be an ongoing virtual support group that community caregiving manager holds and offers. Caregiving is a very local experience. What's available for me in my suburb of Chicago is very different than what could be available for someone who lives in a rural county in Wyoming. And that's why if we connect locally, we have an opportunity to share with others in a similar situation about resources that can help. And that community caregiving manager can invite people to join a monthly virtual support group where others in the neighborhood connect and share about what works, what resources can help, and support each other along the way. So part of the family emergency planning tool includes what we call caregiving wheels. And these are tools that our certified caregiving consultants use with their clients, and they are specific to different experiences. So there's 4 different wheels that are part of this planning session. And here's an example of one of them. So this is the family emergency plan. The wheels are a way to start the conversation. It's a prompt for family caregivers to think, oh my gosh, you know what? I don't have any kind of help in place or a backup plan if I get delayed on my commute home from work. I don't have a backup plan for pet care if my caree is hospitalized. So this family emergency plan is really about how does the family continue if there's an emergency and if there's an emergency around caregiving. The other planning wheel is our plan wheel. I think every worry needs a plan. So we actually have a worry wheel where it's 8 words and a family caregiver can tap into what's the worry right now. And then there's a plan wheel to help the family caregiver figure out, okay, well, what's the plan for this worry? We get caught up in the worries, right? It's this thought process that keeps us whirling. And if we can get out of that and think, okay, but I could put a plan in place. I could ask someone how they manage a situation that's similar to mine. I could build support. I could build a schedule and a routine that could help. I could meet with someone who could be the dog walker when there is an emergency and I can't walk the dog. So it's this opportunity during a 1-hour planning session to think it out and to talk it out with someone who gets it. And that community caregiving manager will be tapped into resources, will know what's available in the community so he or she can make effective referrals. So that family caregiver isn't disconnected to services and help, but rather connected with services and help. Okay, so when we know the needs of our family caregivers, we can actually fund services that help them. And when family caregivers are connected to support and help on a regular basis, they are not isolated in their experience. It's a less lonely experience when you connect with people who live in your neighborhood who are sharing a similar situation. I've often thought that caregiving happens in the home, so we don't really know what's going on in the homes of family caregivers. A few years ago, I had this idea that we should put out ribbons based on whether or not we're a current family caregiver or a former family caregiver. I call them ribbons of care. Orange if you are currently caring for a family member, green if you are in a after caregiving situation, a way to just designate yourself in the neighborhood, because someone who lived across the street from me was in a caregiving situation and I had no idea, none. But if I knew, then I could say, hey, I'm running to Walgreens. What can I pick up for you? It's when we know who's that caregiving in that caregiving situation, we can offer help and support. So here's my call to action. Think about your local community, your town, your city. What services are available for family caregivers? What opportunities are there to add support and services for family caregivers in your town or city? And thinking again, in Illinois, we have these park districts. What could be something similar in your state where you could think about adding in caregiving support and services? And then reach out and let me know. I'd love to connect with you to talk out how we could make something happen in your locale. Okay, so those are our 2 ideas, and we'd love questions and feedback. What do you guys think? Okay, so Becky is sharing an insight, and she says that family caregivers are more worried about the cost of getting a team in place. Absolutely. This is the main reason one family member ends up taking everything on without much assistance. I agree with you. Cost is huge. And that's why I think if we add something like this community caregiving manager and do a sliding scale, it could be something that is affordable for everyone. I am someone who sells services, and I learned something that people will tell you all the time, but I actually lived it. And that is, unless there is some price on services, the services aren't valued. Even if it's just $10 for a 1 hour emergency planning session every year, that is valuable to the family caregiver because they're paying for it. So if it's free, so to speak, people kind of just like toss it aside. They don't really commit to doing it. That's why I think even if it's just sliding scale, minimal pricing based on what the affordability is for the family caregiver, that's valuable for them. And even if they just connect once a year with that community caregiving manager, who then connects them to resources which could be available for them because they qualify for them, but they didn't know they qualified for them and they didn't know that they were available. And if they stayed connected with a virtual monthly support group to neighbors who then could say, hey, anybody else need something from our local grocery stores, Mariano's? Mariano's, I'm running there today. I can drop off groceries for you if you need any help. It becomes this community of care. And that's what's missing right now. That's what's missing. Okay, so Tanya's asking, do you think that towns would be willing to pay for this? If it's revenue generating, I think there's an opportunity. That's why the services has to be priced. It's not free. If it's revenue generating and it helps either pay for the entire salary or offsets most of the salary, I think it could be an idea that local governments will think about, but it has to be generating revenue. I think it's very difficult for a local government to think about expenditures right now, right? So if it generates revenue, it could be a potential. Okay, what else? And okay, so Becky is saying, yes, how? I know how. That's the question, right? So we have all these ideas and we'd love to make them happen. And I think it's just trying to figure out how. And it's connecting with a forward-thinking local elected official who wants to be reelected and wants to offer something truly of value to his or her community. I think that's the opportunity. That's why I also think we need to have elected officials involved in something like this because they want to get reelected. And if they're really serving their communities, they're going to get reelected. And Tanya is suggesting corporations, absolutely, because this could be an employee benefit. So for instance, if I work at my local hospital, we actually have a hospital in the suburb I live. If that hospital and its employees who live in my suburb use the community caregiving manager, that's revenue. So maybe it is part of an employee benefit that nurses and patient techs and doctors who live in the suburb on a regular basis annually meet to have their family emergency planning tool completed. And then the hospital system pays for it because the hospital system is running into shortages. If there's a plan in place for employees so that when there's an emergency, maybe they still can go to work rather than calling off, that is an investment in the employees. Any employer is going to run into situations where its caregiving employees are calling off because of caregiving situations and crises. If there's a plan in place, it can help keep employees engaged and working and productive. We are actually doing this on Friday. We are almost sold out, but we'll do it on a regular basis where we actually offer a CEU if you want to come for an hour and put your family emergency planning tool in place. So we'll do it maybe every other month. So we might do it again in April. But you can follow along with us if that's something of interest to you, so you can experience what it's like to sit with a certified caregiving consultant and talk out your worries to put a plan in place. And so another question is, can someone get certified as a community care manager? And I think the certified caregiving consultant training program that I offer would actually be what the certification is for a community care manager. So the CCCs gain valuable skills in terms of how to have an effective conversation with a stressed out family caregiver. And then they have access to the wheels, and there's 40 some wheels that I've created over the years. And then they're connected to our community of CCCs so that they receive care for the work they're doing, right? Because we get burnt out helping. Part of the reason that I think the CCC training is so effective is that I teach this communication strategy that I've been using for the past 16 years. That keeps me in a good place so that I don't burn out from working with family caregivers. Okay. And if anybody wants to jump in and ask any questions by unmuting, please feel free to do that as well. I so appreciate all your great questions. Okay, so Becky's adding another thought, and she says that she works for a home health agency as a nurse case manager, and it's difficult to get things in place. I would love to be able to implement more community resources. If these resources are available, why aren't home health agency more aware of these programs so we can refer out to them? Exactly. I think there is this disconnect within the systems, and it is a disjointed system. So it's piecemeal, right? You need to know who to call and when to call and what to ask sometimes in order to put the pieces together. But if you have someone in your suburb, so for instance, in my suburb, I had one person who was so well connected to the resources and who's doing what and who's got funding. And when the funding changes, I think that could really help that family caregiver. A couple weeks ago, someone I kind of know reached out to me and said, I have a friend who's in a crisis and she needs to talk to someone. Will you talk to her? I said, sure. What's the crisis? And she said, well, I'm not really sure. If you don't know what the crisis is, it's really difficult to make an appropriate referral. So I said, just have her call me. So she did call me, and the crisis was her mother-in-law was hospitalized and they were trying to figure out the discharge plan and where she could go. They were also trying to figure out if she was ready for hospice. So it was a lot to figure out. But if that family had connected to a community caregiving manager, they would have a plan in place. If there was a hospitalization, they would know who to call. So instead of trying to struggle with, oh my gosh, who do I call? We're in a crisis. I don't know what to do. You just call that community caregiving manager and say, okay, we've hit a crisis. I thought we had plans in place, but those plans have been blown up. What do we do? And then that community caregiving manager is familiar with the story. So it's not just starting from the first step, it's starting from, okay, I have a relationship with you. I know what values and priorities you have. I know what you value and prioritize around caregiving. And I have an idea of what values and priorities are important to your caree. So let's figure out the plan. So someone else is suggesting that the Gates Foundation could be a resource for us. Wouldn't that be awesome? Because we know that Melinda talks about caregiving issues on a regular basis. She has been writing opinion pieces and editorial pieces around caregiving as an issue for women. And I think she would be awesome. Yep. And so Becky's also asking, is the community caregiving manager employed by the town? Yes, I believe that that is actually a position that is held in the local government. And again, it's these planning sessions that generate revenue that help offset the cost of the salary of that community caregiving manager. And people find you because when you get a water bill, there's an invitation to schedule your session with your community caregiving manager. When you go and vote, there's a reminder to schedule your annual family emergency planning session with your community caregiving manager. When you get a catalog, for instance, of what activities are going on in the park district, you are invited to schedule your planning session with your community caregiving manager. I think there's so many opportunities locally to get the word out because the local government is communicating with you regularly anyway. So let's just add in another invite. Yes, Tanya, absolutely. So depending on the size of the town, you could need more. So I think about the city of Chicago. We have our Department of Aging for the city of Chicago, and there are 4 or 5 satellite sites for senior services. So it could be something similar. So depending on the locale, there could be a community caregiving manager, for instance, for the Northwest side, for the far north side, for the Southwest, for the Southeast side. So it could be regional depending on how large the community is. And so cost, there's one more comment, cost offsets could be reflected in a Medicare star system. Sure, yeah, more stars equal more money. Yep, absolutely. There's absolutely an opportunity for reviews tied to reimbursement. Absolutely. And then someone else is suggesting that maybe get sponsorship from Walgreens or CVS or a local senior center. The only reason that I would be a little hesitant to attach it to a senior center is because people really believe caregiving issues are issues of seniors. And you might be a senior in a caregiving issue, but family caregivers oftentimes are not seniors. So we want to make sure that it is considered to be something for the general population. It's not attached to age, it's attached to the experience of caring for someone in the family. So Rebecca, what are you thinking? Oh, there you go. Oh, you know what? I thought you were going to unmute yourself. There you go. I just asked you to unmute.
Thank you. Sorry. I think that this local initiative that you are talking about is vital to make this all work. Local politicians, local organizations, corporations. I do think with this kind of, as we're looking at what the federal government is thinking of doing is pushing more money into these programs and taking a lot of things away from the states. And I'm wondering how that, I myself I'm wondering how can we disseminate that? How can we say this would be paid for federally and this would be local? And is this a local tax-based thing or is it federal? So I think there's some more things that we need to find out about that, but some money at least is beginning to flow with this economic plan. And so I think there's a ways to tap that resource and get that money into the community to help accomplish what we're talking about accomplishing. So funding is always a problem with everything, isn't it? Where do we find the money?
Right.
The best ideas, getting them implemented. And you're right, this has to be a compensated initiative. It cannot be volunteer.
Oh, no, right.
So,
Yeah. Right.
it's
Yes.
asking way too much of people to do these
Yes.
kinds of coordinated activities and efforts without being paid for it. And I love your Caregiver Academy because it has all the different levels of caregiving so that you can become a real community caregiver where you're a case manager, right?
And you made me think of something. There actually are plenty of job applicants in our communities because of all the former family caregivers that would be awesome in this
Yes.
kind of position. They already know how the system works. They already know about resources. They already know how to connect to resources. So wouldn't that be amazing if every locale actually tapped into the existing talent pool they have and pulled out a community caregiving manager? Wouldn't that be awesome? And we know, as you talked about, that caregiving is an economic problem. If we solve the problem if we look at it as an economic problem, we solve how we're going to support and care for family caregivers. So I think I talked to you about this, Rebecca, on the phone. So I've done this presentation, which is called The Future of Care. And I talk about how the community is a circle, and there's a caree who's healthy in the circle, and then there's a family caregiver in the circle. And this is prior to caregiving. And then a disease or an injury or illness happens, and so that caree drops out of the circle. They're no longer spending money at restaurants, they're no longer spending money at grocery stores, they are no longer a consumer in the community. And then that family caregiver drops out too, because they don't have the time or the resources or the energy to participate as a consumer like they once did. And if we can bring that Carrie back into the circle of community and bring that family caregiver back into the circle of community, so he or she has time and energy and resources, we help that local community. Okay, what other questions or thoughts or insights do you guys have about our ideas? I want to ask you, Rebecca, about federal and local. So I guess federal makes it happen. If there's a federal mandate or a federal program, it has to happen. And then there could be consistency around the program. Although when I think about, for instance, funding for area agencies on aging, there is federal funding, but every area agency uses that funding a little different. And maybe that's okay because the locale will dictate effective use of that money.
That's right. And the other thing that we're talking about is having the money to get this up and running and coordinated. And we already have some systems in place, and it's just strengthening them within the communities. But one thing I wanted to expound on a little bit is the urgency with these. Think about this: if 65% of nursing homes close down, where are people going to go? You could always try to get another nursing home, but it's going to be capacity and waiting list. And the thing about this economic plan, which concerns me, is it doesn't provide additional funds to keep these nursing homes in business. All it's going to address is providing critical funding for states to deploy strike teams to these long-term care facilities. And those strike teams, you remember those are those resource teams designed to help workers manage and respond to an outbreak, and better conduct infection oversight. Well, that's all great, okay? We need those. But no funding for these long-term care centers, no funding is discussed yet in this budget. I don't think we realize what kind of a crisis we're coming up against here and how much we're going, if those do indeed close, and how much we're going to need these care coordinators in communities to be in place and ready to assist. And if that can come down from federal funds and filter through a local community, we might have a chance of getting people trained. And the plan was also to train 150,000 caregivers. Who's going to train these? Who's going to put these into the community? And that's another way. Wouldn't that be great to have the money for the resources to get those people what you're offering to these? And your caregiving training would be so invaluable.
I actually was working with a funder in Michigan to train their community health workers to become certified caregiving consultants. And I didn't get very far with that, and I didn't get it, but Michigan has always really invested in their community health workers. So there are opportunities within different states to look at what's already there, and then how do we just strengthen what's already there.
Strengthen what's already there, exactly.
So
I like N.W. Wright's suggestion here about community colleges. What a great place to implement your program, actually.
Yes, yeah, I think that would be great. I think that would be great. And really the certified caregiving consultant training takes that personal caregiving experience, what you gain in terms of knowledge about life, insights about resources, and strategies around how you continue by managing stress. And then I take the insights I've gained over the past 30 years and how I have effectively worked with family caregivers to kind of open it up to expand that perspective. Absolutely. Yeah, so Sherry's writing, the most important takeaway from this session is how family caregiver support needs to be, I apologize, I just, let's see, needs to be reorganized meet expanding care needs. And really, Rebecca, what you talked about with what happens when long-term care facilities close or aren't readily available in a community. What happens in that community? We saw that actually with rural economies when a hospital closed and when a long-term care facility closed. Those are employers too. So not only do they bring revenue into a community, but they also provide a needed resource for that community. And when you're caring for someone with dementia, if the behaviors are really challenging, it's really hard to think about managing it at home. One of the actual participants in our CCC training program right now placed her husband in a facility. He was diagnosed with frontal temporal dementia, and his behavior was violent and erratic. She did everything she could, medication, reached out to doctors on a regular basis, but it was impossible for her to manage it at home. She literally was in the house 24/7 because she did not know and did not trust when she could step out to run an errand and he would be okay. Yeah, and we think about the images of what long-term care facilities mean to us now, and that image is the window, and it's the two hands on either side of the window, the caree's hand and the family caregiver's hand, and just that image gives us pause about whether or not a facility really is the right answer for us.
Well, as I was discussing earlier, I thought it was interesting that 80% of people with dementia are cared for at home
Yes.
until they move into those stages where they qualify for Medicaid assisted care in a long-term facility. Um, and the average person cares for a dementia patient in their home for 4 years. That's a very long time before you can get them into a facility. And wonder if what you were talking about, that critical stage they reach where it's almost impossible to care for them at home. Even if you have help, it's so difficult. And if these facilities aren't there, I feel like what's going to happen is this is going to become a crisis situation, management by crisis, which we often do.
Yeah.
And when all of a sudden we realize these nursing homes are closing down, and where are we going to turn? They will pour all this money into an effort that if we don't provide them some kind of structure, they're not going to have how to best implement it. Wouldn't it be great if we could get a structure set up for that?
Yeah, and really take care of these valuable healthcare workers in
Yes,
facilities and in home health agencies. We have to take care of them with good wages and benefits so that, for instance, when there is another pandemic, we're not running that same risk where it's an employee who works at multiple facilities because that's the only way he or she can pay the bills. And that becomes the risk of spreading that particular infection.
absolutely.
I
So
think
we
it,
are called in a healthcare crisis and an economic crisis. I mean, with the COVID, it makes everything that much more difficult.
yes, yeah. And Tanya is actually speaking to that. She writes in the chat room, I think that dealing with social isolation and loneliness is going to be a huge spot to watch in the wake of COVID. Absolutely.
Actually, one of the things when I was saying people are bringing their parents home, and you're talking about that isolation, they have watched through the window because they cannot visit their loved ones. They cannot go in, touch them, cut their fingernails, brush their hair, the things that we do when we, the lack of touch. There, these people who might have gone to dinner in the dining room, they can't leave. They're isolated in their rooms constantly. And you're absolutely right, because there's a big wave of additional care coming in relation to how these people have been isolated. Not everybody's in a position to take their parent out of a nursing home or their loved one. And they've had to watch this, and they are sure that their parents are dying of isolation because they believe isolation kills too.
Yeah, and Tanya sharing in the chat room, I haven't seen my parents in over a year as they are in London.
Oh,
It's killing me.
I'm so sorry.
It's this trauma. It's trauma that we are experiencing so significantly.
this COVID is affecting everything that's already so severe. It's making it a crisis. And yes, not people have not seen their parents for, like you say, a year. Even if they're in an assisted living, they can't get to them. There are organizations that are addressing that and making some headway, but with this next wave of COVID coming that they predict, it's going to make it even more difficult.
I think Erica wants to jump in. So Erica, go ahead and unmute.
Okay, thank you.
Sure.
Hi, I'm Erica. I'm the QIDP for Gilman Healthcare Center, and I just wanted to touch base with what you guys were saying with the whole traumatic of isolation, and it's so true because being here at the nursing home and not being allowed visitors, and like some of these people are married and some of them are younger because I'm the director of the developmentally disabled program here, and so maybe not so much my residents, they're definitely affected as well, but like I'm speaking of this specific incident of a married man. He's heartbroken and thinks his wife doesn't love him and thinks she went with somebody else, and she doesn't come to visit me, and I tried to explain it's not her choice that she's not coming to see you, it's because of this COVID. And I've never seen a man break down like that, and it's so hard. And like just just with the room change, he changed rooms because he went out to the hospital and came back on isolation and stuff like that, and so he was just really over the top confused and stuff. But this whole COVID stuff has taken a number of tolls on even the DD people that don't exactly know what's going on. They feel it and they know that they have to stay in their rooms, and everyone's just so like stops eating and doesn't want to do any activities. I try to do hallway bingo and stuff like that, and it's just I've definitely seen a change in every single one of my residents and the other residents that I don't know that well too. So it's definitely hard.
And how are you receiving support for what you're experiencing, Erica?
The social worker here, I speak to her on a daily basis, and just because I get overwhelmed sometimes too, because I'm heartbroken that these people are just so sad, and they're losing weight, and we're doing our best that we can, but yet, like you said, a nursing home just like 30 minutes away is closing down, and we're trying to take their residents. However,
Yeah.
we don't have staff because COVID hit us a couple times already. And so, staffing issues and just not enough help, and just still accepting other residents from other places because they're closing down because they're not big places. And it's just, and our job security isn't really that good right now either, because who knows, anything could happen. But I talk to my coworkers, and we keep each other locked in and checked in and stuff. And our administrator, we have a morning meeting every day. And I have a good supportive family and a husband and stuff like that. I had a daughter during this COVID stuff, so that was really hard too. My Everyone wants to meet my daughter, and I can't bring my daughter in, and it's sad. It's really sad, but just trying to keep everyone's hopes up and happiness, and just try to make the best of it. But it's getting tough.
Erica, did you say you're in Gilman?
Yes.
Okay, so Gilman, Illinois is in central Illinois. It's
Yes.
up. I just wanted.
Thank you for letting me share.
Oh,
Sorry.
sure, of course.
Erica, I
Yeah.
would just like to say that what you're doing is so significant. That's why caregivers of every kind are so valuable to society. Look how much you care. Look how much you want to make a difference. Look how your hands are tied, and yet you do all you can with, fewer
Yeah.
resources. I'm grateful to you on behalf of all
I
caregivers.
appreciate that. Thank you.
And Erica talked about broken hearts, which is what Tanya was talking about. She's brokenhearted that she can't see her parents. And I wonder, how are we going to actually heal all the broken hearts in our communities? And it's the silent broken hearts, right? We just are getting up every day and just I'm like, okay, I got to keep moving. I got to keep going. What's really interesting to me is I co-facilitate a grieving support group twice a month, and we are having participants join us who had a significant loss years ago. And now, because there's time in their day, they're feeling it because there's not that busyness to kind of dodge it. Now you have to kind of like manage it. And I think about that too for everyone who has really significant broken hearts, how are we going to take care of them so that they are healed and healthy? Because we know that takes a toll on our health too.
It does take a toll on the health. And if I may, another thing that you're talking about in relation to how do you, my niece has a PhD in physical therapy, and she's very concerned about even getting these people back to where they were, even if we were COVID free, to get them back physically. And it will take psychiatric help to get them back emotionally. I mean, there's going to have to be a lot of intervention to bring these people even back to where they were because they've declined so much. Just sitting in chairs all day instead of even walking down the hall, little things. But you're so right. And another thing you're talking about, the broken hearts. I have received private emails from readers who have actually referred to, interesting to me, having post-traumatic stress syndrome after being a caregiver. What if it, how traumatized they were. So there's a whole basis of that we will need to pull on resources to help people get back to where they need to be.
Yes, absolutely. I have been trying to find, I'm just sending a quick note in the chat room. I've been trying to find statistics around PTSD as it relates to family caregivers, because I had a member of a website I used to own who would come into the chat room with me, and she every day she had a trauma because her husband was epileptic. And when he would have a seizure, it was incredibly traumatic for her in that moment. And it was traumatic for her because of the other seizures that he had had, where she would just watch him and think, oh my gosh, I think he's going to die. Which just really started the conversation about, oh my gosh, how many of us really have had these significant traumatic moments during caregiving, but caregiving doesn't give us the time to process it. We have to just keep going. We have to manage the moment and the moment after that. And then caregiving ends. And again, we have that time. How do we process all of that? Okay. Tanya, are you with us?
Yeah, I am.
Okay.
So I just want to say from the bottom of my heart, this is just so useful and so interesting. And one of the things that I had thought of, and I do believe, I'll keep it quick, but I think it's a big idea, is something that I've actually done with a family member, is storytelling online. And I feel that there is an opportunity. I have a background in qualitative market research, so I interview people in little groups or one-on-one, and I really feel like there's an opportunity. If we were talking earlier, that's part of the caregiving responsibility. And I feel that it is therapeutic as well as educative with this family person. It literally warmed up 3 months of their life. And there is a book at the end of it, which is a legacy piece to transmit to children and grandchildren. And it has meaning for the recipient as well as the interviewer. So as part of the community care manager thing, which of course I absolutely love, I feel like there is an opportunity to introduce this across the country. And that would be something I have particular heart for because of who I am, because of my work experience. I'm also a gerontologist, and it's literally visiting all those lonely people. It's like what you're doing right now. I'm not being videoed because I've got my coffee here and my desk is a mess, but my hair is done and my makeup is on. You should all know. But I'm just saying, it just brings such joy, when you see someone else's face and you giggle. I mean, you can have a cup of coffee down Zoom. You can do it with a friend. This poor man that I think this other lady was talking about, who's on his own, maybe his wife or his children, or maybe a stranger. Sometimes you tell strangers stuff that you don't tell your family members. I know I've been working with elderly people. There was one 98-year-old that I was actually writing her life story with, and she goes, my children didn't know this, but I want them to know. You can put it into the book. And so I'm thinking that needs to be, a national initiative which can reduce the isolation and the loneliness and bring something so valuable, warmth, humanity, and togetherness, literally in a tangible, keepable way. And, training the same way you train caregivers, that's another aspect of it. Some people will do it better than others. But I just feel maybe this poor man will see that his wife is not with somebody else, that there's some other person who's come into his life who can bring some joy as well. So I just thought I'd throw that in. And, I've definitely, anyone wants to talk to me about that, I'm happy to work on that, because it's just such a meaningful thing.
So there's a couple organizations that do something similar, StoryCorps. Any of you guys have heard of that? They record stories. There has been a significant movement to record stories of vets. And then there's another organization that is, I think it's Age Well, and they had journalists go into facilities to capture stories of residents. I don't know what they've been able to do. Maybe it's Memory Well.
It's not the same level, though. A lot of it is more superficial. Do you know what I mean? Like, what I found with old people is sometimes they go back into the past, literally tell from their childhood on, and it's really therapeutic. And they know they're doing it for them to escape this unpleasant, present, but it's also giving a present to their, descendants. This is what I was when I was a little girl. In fact, someone just sent me today a photojournalist who was taking pictures of, let's say, an 80-year-old now and a picture of her when she was 10. That type of stuff. So
Yeah. I just wanted to mention that there's a couple of organizations that do something similar, just to let you know that there's already some interest in doing that. And there definitely is, I think, the value in the capturing the story. And when I think of family caregivers, not only do they provide care, but they are the family historian. They are the one that has spent the most time with someone in the family. They're the recipient of the stories. So our certified caregiving consultants actually offer sessions after caregiving ends that is around legacy listening. So we listen to the story the caree has told that family caregiver and capture those stories for the family caregiver. And then we listen to the stories of the family caregiver, because oftentimes it's hard for a family caregiver to find a listener who can stay present in stories of pain. Sometimes the stories of caregiving are very painful. And so we know how to stay with someone in pain in a way that treasures them, helps them feel okay about, this was painful for me, and to let them know we understand there's a reason why it's painful. So yeah, excellent. Thank you so much. I'm so glad that you jumped in and shared. Absolutely. Absolutely. Such opportunities with the stories, such opportunities with the stories. Okay, so I promised that I would be respectful of your time, so I'm going to close out. Rebecca, thank you so much. So great.
My pleasure. Everyone here, it was great to participate. I love the participation. Thank you, everyone, for including me.
And thank you guys so much for being with us these past few days. Your conversation has really enhanced the discussion of the ideas. We so appreciate it. Again, there's an email that goes out in just about 15 minutes that does have a link to the evaluation. So please let us know what you think. We'd love to know. And if you are here for CEUs, you do need to complete that evaluation. Okay, thanks everybody. Take care. Thanks for being here. Bye-bye.
Bye-bye.